Good evening. I'm Dr. Bonnie Price-Linden. I'm a New York State and Michigan licensed psychologist, pediatric neuropsychologist, and I'm here today to provide an introduction to a number of courses that Birch Price and Associates is going to be providing in the area of inclusion and diversity, particularly as it relates to neurodiverse individuals and challenged individuals. And today we're going to provide an introduction, a 1-hour introduction into the topic, from the idea of what is neurodiversity to the ideas all the way to what do I think might be possible to provide an opportunity for businesses to be more inclusive of neurodiverse individuals. So here we go. Just a second. Share. So, just one moment. Let's talk about the origin of neurodiversity. Problem is that the origin is very unclear. We really don't know what causes it. We've looked at genetics, we've looked at it acquired by accident, we've looked at environmental issues, something that happens during pregnancy. Most of the children I work with, it comes out immediately at birth. Something has gone wrong. And it always seems to be traceable during that period of time, just a few days either before birth or right after birth. More and more, it seems to be coexisting with other medical issues, leukemia, multiple sclerosis, but we don't know why. We have guesses, but the guesses aren't good enough. So we simply have to look at what happens when somebody is neurodiverse. In fact, is there a pattern of being neurodiverse? Maybe there's not. In fact, maybe neurodiversity is just with strengths and weaknesses along a continuum, which fall around almost every man, what is called a bell-shaped curve. And in some ways, a neurodiverse person is just as similar as anybody else. In fact, neurodivergence can deviate from one another in every respect, from the earliest onset at birth with swallowing and severe neuromuscular delays to more specific language and communication difficulties. Sometimes they say, well, if the strengths and weaknesses are kind of similar, the person isn't neurodiverse. But after evaluating so many children, so many people, I can tell you that probably that's not likely. So when we look at somebody who is neurodiverse, are we looking at somebody within themselves, within their weaknesses and their strengths? Or are we looking at somebody who we see as different from us in one way or another? And do we respond to that difference as saying, well, they're neurodiverse? So what separates the two between being neurodiverse and what is called neurotypical or normal? Let's look at some of the areas that are coming under the definition of neurodiversity. Autism spectrum disorder, attention deficit hyperactivity disorder, attention deficit disorder, dyscalculia, which has to do with math, dyslexia, which has to do with reading, dyspraxia, which has to do with developmental coordination disorders. What can we learn about these that might help us to decide what does it mean to be neurodiverse? Here are the statistics. Currently, 1 in 36 kids are diagnosed on the autism spectrum. By 2025 or sooner, 1 in 25 kids will be diagnosed on the autism spectrum. And that's only if they're diagnosed, because it's very likely that we're looking at an even larger population. 10% of these children are employed without specific accommodations when they get into the workforce. 20% more talented people can be employed with accommodations. This is a very, very small percentage of the people who are diagnosed with neurodiversity. What's the economic impact of unemployed people on public spending? 85% of autistic people are unemployed as compared to 10.8% of people with disabilities. The unemployment rate for people without disabilities is 5.2%. 58% of people with ASD have never had a job. The majority of jobs held by ASD people are typically part-time, unskilled, and poorly paid. Long periods of unemployment when they do become employed. And as somebody who has been a forensic psychologist in terms of these kind of issues that come up in corporations, even when someone comes in with accommodations, it's been very, very difficult to keep the people working once the corporation has decided that they no longer want to handle it. So what's the economic cost to our country? The cost of caring for neurodivergent Americans was some $268 billion in 2015. The expectation is that by 2025, it will be $461 billion. The basic issue is effective interventions that support neurodivergency across the lifespan. This came from Autism Speaks. The vast majority of autistic people cannot achieve independence and live their lives fully. They are very dependent both on their families and government subsidies. Can the perspective of employers be changed? What are the barriers affecting hiring practices? Well, the neurodiverse individual, as I just suggested a moment ago, comes into the corporation with deficits in very important areas. Their social communication skills, their social interaction is often restricted. They avoid social contact in the organization. They can become very distressed when their rituals or routines are interrupted. They can become very frustrated when interrupted. In many cases where a manager is involved, they resist attempts to redirect. The design of the project and the timelines of the project sometimes are, or in fact often, are very difficult for them to maintain. And often they do not speak up. Let's look at why some of this may be happening. The neurodiverse person is most likely having a difficulty with how information goes from one point to another in their brain, the way they process the information. And what happens is that as the information is being transmitted, the information becomes spiky, so that sometimes it gets through and sometimes it doesn't get through. This leads to a very serious problem with memory, and the neurodiverse person then is thinking, how do I manage this? So they're looking for alternatives, and more time is being used in managing the information that someone may be standing there waiting for them to offer. Here's a graph. So when they look at the spikiness, the flatter line is the person whose information is getting through quicker. It's getting through more even, and they don't lose all that time in trying to recall the information or even knowing that they really didn't hear everything that was said to them. And so they are at times at a loss. And so we get this spiky profile, particularly in the area of memory and processing speed, that is a very difficult, a difficult situation for a neurodiverse to overcome. So we're going to remember this spiky profile as we start to think about later on in this introduction, what can be done. So when we look at a breakdown of life skills that are necessary, because we already know that information and information processing and speed with which you process that information is very important. When you look at the breakdown which was provided by the British Medical Bulletin of what are the skill deficits, if we turn it around, those are also the skill strengths that we are looking to put into every individual, so that when they do get to be employed, that they will be able to manage these issues. And over, if you look at the skill deficits, it's in time management. I would say that beyond the issue of concentration, attention, and self-regulation is this issue of the spikiness, that it really is unreliable. And that is the experience I feel secure in saying of the children, that they are really, from very early on, feeling very insecure about how they are processing information. So we have time management, concentration, attention, self-regulation, maintaining employment. This is skill deficit, difficulty with teamwork. It's obvious. If your information is spiky, you're going to have trouble with the other team members. And so we look at it: social and communication difficulties, need for routine. People who are experiencing a spiky executive functioning or delivery of their information are going to have all these issues. Let's see, stress management, participating with other people in the workforce. They're going to shy away because they know underneath it that they're having a real difficulty. The life readiness skill that we need to reach out to is to eventually have people with all the skills that we just spoke about able to think logically, able to analyze the situation and come up with a sensible solution. But we know that if they're having trouble moving the information forward, they are going to have, and maybe missing information, they're going to have difficulty processing that information and being a serious or capable person in the team. So here's the big issue. If you're having those kind of problems, it's likely you're going to mask them. And so often when people come for employment, they're going to be maybe not presenting the full scope of the situation. They are doing that out of self-defense to camouflage it. They are not really going to be willing to tell you that they are having these kind of difficulties with memory particularly, and the loss of information or the slowness of the information. They want to avoid stigma. They want the job, and they want to be socially involved. They want to have a sense of belonging. But when you mask who you are, neurodivergent people often end up feeling inauthentic, and they feel like they have no sense of self. For some people, masking can even feel like an act of self-betrayal or feeling they are being deceptive to others, not truthful, fooling the world. And biases that prevent autistic or neurodiverse people from securing meaningful employment. I suggest that of all these biases, the one I would ask you to look at is the bottom one. Biases due to fear of consequences for risk-taking. The company, the managers, would be taking a very large risk. That's, I believe, how they see it, because of experience, knowing that having a neurodivergent person on the team can result in having a lot of these difficulties. I think the biases of the neurotypical person or the person who is not evidencing these types of difficulties would also be probably reticent about having someone on their team that they may think that they have to carry. So there are many biases to overcome. And then the American with Disabilities Act is saying it's a civil rights law that prohibits discrimination against individuals. So they have a right to work. How do we include them? How do we make it possible that the team can progress, or the business as a whole can progress, faced with some of the issues that a neurodiverse person brings to the table? So here we go. What are the intervention strategies that have been used up to date? And the most significant one that really begins almost as soon as the child is born, once they are sent into some kind of evaluation and some kind of program, is applied behavioral analysis. And these are the system that underlies the programs that the children are presently, almost 90% of children are being exposed to. And this program requires that they see neurodiversity is not related to the brain skipping or the issues with memory or the issues with speed. They see it as behaviors that need to be reduced one way or another, either through reinforcement to increase a desired behavior, or behaviors that are not reinforced or negatively reinforced or punished will reduce and eventually disappear. So this is all about the behaviors. And the Association for Behavior Analysis in 2014 made it very clear. Research to practice gaps are universal across professions. And what that means is that when you are doing research with live subjects, not in a laboratory, it is almost impossible to come up with reliable evidence-based research because there are too many variables. ABA, Applied Behavioral Analysis, they found, produced remarkably powerful interventions in education and organizational behavior management situations, to name a few areas, but is not proof capable of generalizing to important settings and scales of social importance. Just one moment. Just one moment, please. Okay. The Department of Defense undertook a study to see whether the applied behavioral analysis was a valid program. The Cleveland Clinic was involved, May Institute, Nationwide Children's Hospital, Vanderbilt University, and University of Rochester Medical Center. And the Department of Defense in 2023, after 3 years of study, found that no significant findings that there is evidence-based research that ABA is overall beneficial and makes a difference. They found that family support is a critical factor in any intervention that is used to assist neurodivergent individuals. And actually, this month, the Autism Care Demonstration Project was extended by the Department of Defense and the National Academies of Science, Engineering, and Medicine to analyze those results and see if they came up with the same result. This is now extended until 12/31/2028. The medical student section of the AMA moved to remove the support of ABA from the American Medical Association. And we're going to look down here and we can see what the issues were. They said that autism treatment represents a fragmented industry that consists of a mixture of for-profit and nonprofit organizations, with the top 9 for-profit chains making $547 million and a market value in the billions. ABA was conceived by Dr. Lovis to condition neurotypical behaviors in children he viewed as incomplete humans. And this pretty much has been how children have been the main intervention strategy for the children who eventually come to be employed. The desired behavior is often defined by the adult or behaviors. So this is an other control situation. The person who is doing the reinforcement is making the determination what is normal and what is not. ABA practices are historically based in abuse, and this is coming right from the presentation that went to the American Medical Association, as holding autistic children's communication hostage. Modern ABA still abides by the founding principle of making a child appear normal. So if we go back to masking, is it any wonder that people then go, when they're going to be employed, are going to work very hard to mask anything that doesn't appear normal? Current AMA policy supports alternatives to ABA, such as the Developmental Individual Differences in Relationship-Based Program and other programs, and that AMA is now supporting new research towards the evaluation and the development of interventions and programs for autistic individuals. They are looking to create a forum for the stakeholders of primary and specialty care to look at the issue of diversity and personhood of individuals who are neurodivergent, including people with autism. So if we keep going back to the fact that the information skips, that it affects memory, it affects speed of being able to do the job, it affects masking, we can see that by the time people are ready to be employed, they haven't worked very hard or learned much about how to self-regulate. Highlights of the American Medical Association. This is the resolution that they came to. ABA is propped up by lackluster scrutiny of the quality of the science justifying its use. ABA has become the single most reliable way to make money in the human services field, except for being a physician. And ABA uses behavior modification to eliminate behaviors that others deem undesirable, focused on making the child normal or indistinguishable from their peers. Studies conducted by the Department of Defense the last 3 years, this is still coming from the AMA, demonstrated a lack of correlation between improvement of symptoms and hours of direct ABA service. Basically, ABA is a multi-billion-dollar enterprise. Again, this is the American Medical Association. So American Medical Association changed its mandate and said now they support coverage and reimbursement for evidence-based services for autism spectrum disorder. And they removed but not limited to applied behavior analysis. So they are very interested in finding out what intervention strategies may work. One other thing, early intervention for individuals with developmental delay. The AMA supports the early intervention by physicians identifying children with developmental delay, to urge physicians to assist parents in obtaining access to appropriate individualized early intervention services. The big problem is, if not ABA, then what? In Vermont, I think this is 2009, they undertook a study to see how many of the physicians were actually diagnosing developmental delays and in what manner they were. And they found that only 1 in 4 used appropriate structured, validated screening tools, and the pediatric practices were more likely to screen. So in 2018, Blue Cross Blue Shield of Vermont reset their system and said that developmental screening at 9 months, 18 months, 30 months, and autism screening at 18 months, 24 months. Again, I think recognizing that if we screen very early, we have the best opportunity to deal with some of the issues that come up in the neurodiverse profile. So one and done interventions just don't work. We know that early as possible identification and intervention offers best chances of minimizing areas that will be challenging. Behavioral programs relying on reinforcement are, by their nature, extinguishable. Once the reinforcement is removed, the behavior usually reoccurs, or to some degree reoccurs. Behavioral programs do not result in building later in life work readiness skills or social adaptabilities. No two brains are the same. I think that's the first thing we have to really understand. Even in neurodiversity, the skipping can be very different from one person to the other. There is general consensus that the unique attributes associated with autism and other neurocognitive disabilities should not be distilled down to a set of symptoms and vulnerabilities in need of correction. Without early and ongoing interventions, there are significant developmental consequences that can ultimately limit opportunities, mainly employment. The focus needs to be on decreasing medical treatment, stigmatization, and depersonalization towards skill acquisition. So what are the benefits of neurodiverse individuals in the workplace? The literature says they're focused and productive workers. I would say that it falls on the bell-shaped curve. Some will be, and some may not be. Individuals are committed to high-quality work. Again, bell-shaped curve. Entirely different perspective, a key element of creativity. I would say, I would keep directing you to the bell-shaped curve, every man. Some will have those characteristics and some won't. Opportunity to create a truly inclusive and diverse workplace where people with many different backgrounds collaborate. Very true. Very true. And I believe that there is a reasonable way to include neurodiverse in the workplace. So let's keep going. So I looked at 7 companies who have established neurodiverse programs in hiring and nurturing neurodiverse talent. And mostly they're focused on training, mentoring, and support. But time management is really the major issue. And I didn't really find that in the programs that I looked at. The mentoring program suggests that if you mentor somebody with a person who's not neurodiverse, that will solve the problem. pre-screening placement, without really knowing what you're screening, that may also be very disappointing. Training and coaching in 8-week internships by Goldman Sachs. Again, I don't know for certain, but I would assume that unless the people who are doing the training and coaching understand the skipping, understand how the brain sends the information, and understand how to intervene with that, that I would assume that's, unless they are doing that, that would be would not result in the positive success that they would like to see. Microsoft does a week-long hiring program and structured interview. Clearly, the structured interview is probably the best way to proceed, which we're going to discuss shortly. But here's what I thought was the best. I thought JP Morgan had it. They were looking at how the brain functions. They called it neuroscience games. I don't have access to what those games were, but they were looking at measuring cognitive, social, and behavioral attributes in order to better match job candidates with the function that they were going to be playing. I thought that was the closest of all the companies to what really had a chance to be successful. Which is a consulting firm, have customized the onboarding process along with a trained office buddy system. Again, it depends on what the system is and what they're looking to train that I think will make the difference. Stanford University, they have a neurodiversity project, which advises employers of opportunities and success metrics for neurodivergent individuals in the workplace. Again, we're back to the coaching and support. And I don't think that without understanding that this is an executive function or brain system situation, that any of these programs other than JP Morgan would likely succeed. I don't know all their statistics though. So I looked at this program. This is the most recent one I found, and this is done in Italy. And to understand this program, it's the only one that was looking at social skills and cognitive training to support work-related skills and job placement. But this program was set up by a neuropsychologist and was definitely focused on social skills intervention, but it had the backing of the government, and the government was paying or supporting this study. So the study was, if we give everyone pretty much the same kind of setup that they had while they were going through school, which is a multidisciplinary approach, OT, PT, supportive services, everything, we can move them into the workplace. And the purpose was to foster cognitive functioning, especially executive functions, as we've already discussed, and social skills, which they are describing as soft skills in work context. And the ones that they are seeing, the deficits that they are seeing as creating most of the difficulties in finding and keeping a job. So they were basically focusing on a very important thing, helping people to be able to think for themselves. I'm going to put it just like that. And they were going to teach them the social skills and training to enhance employability. The thing was, with this study, the IQ levels were very low, and there were very, very few people in the study, maybe 9, 10 people. So the neuropsychologists served as the evaluator and team conductor. There was social skills training to improve participant job skills, all very good. Professionals to provide cognitive and psychological support, professionals to provide speech and language skills, psychological and neuropsychological testing. And they were using a model called First Place Then Train, which basically said, just put people into the situation and let them handle it. And then provide the necessary training and support to successfully manage these placements. The individual placement and support model had 8 principles: competitive employment, systematic job development, but look here, 0 exclusion, time unlimited supports. Worker preferences, what they mean by that is that they would ask the workers, what did you deem as most beneficial, which I think is a very good plan. But there was no loss of job here. There was no, we were out of time. This was, this is a job, and you're going to stay with it, and we're going to keep giving you services. And I think that probably this is an unrealistic approach. In fact, I know it is. So what did they do with the behavior skills training model? They identified the skills and interests. They used instruction, explain the skill, modeling, show the skill, practice the skill, and feedback, report on how the skill was performed. In my mind, looking this over, this is a applied behavioral analysis approach, very little difference than applied behavioral analysis. But this is the approach that they used. They set up internships to train them. Groups were set up by goals, cognitive enhancement and job-related social skills improvement. Group remained intact throughout the training, and it was 18 sessions lasting 90 minutes each. And the focus was to assist adaptation skills. Here's the most important thing that came out of that study. They wanted to improve attentional functions, auditory and visual attention, selective and divided attention, shifting abilities, all the issues that neurodiverse people bring to the work environment. They were looking at executive functions, again, our working memory, go back to that, the skipping, verbal fluency, planning and problem solving, flexibility and inhibitory control, enhanced memory functions, short-term memory, coding, storage, and retrieval. All of the skill deficits we saw in the earlier slide from the British Bulletin. Those are the things that we need to focus on when we look at programs for neurodiverse people. The social skill training group was a total of 10 meetings lasting 75 minutes and was led by a cognitive behavioral psychotherapist. Again, this was an individual placement and support theory. Put the person into the situation and let them handle it. So I'm going to say that I think that kind of focus is probably the least effective and probably not going to support you. First of all, there is no exclusion. Nobody gets fired is not really realistic in most corporations. People are getting paid, and the person who's paying you deserves the appropriate amount of work as everybody else in the system. And people do get frustrated with the time, the skipping, and the memory. So I have come to the conclusion that you have to decide before you bring neurodiverse persons into your employ, if hiring is based on the benefits of the individual to the team or workplace, meaning what is the talent that you're bringing into the workplace? Not the weaknesses, not the vulnerabilities, but what is the talent? Identify the skills and professional interests in the group individually. Establish the work-related skills necessary to complete the task. A neuropsychological profile and structural inventory. Ask everything you want to know about the candidate in writing or audio and have the individual answer. They can do it at home. Can be multiple choice. Can be anything that you and the neuropsychologist or the person who's heading the team want to know, because this is not a weakness-oriented evaluation. This is what are your strengths? And if the strengths match what we are looking for, then we go further. So I am suggesting that cognitive and psychological testing by a neuropsychologist if the tasks are extremely complicated. Pre-employment assessments. Structured interviews would evaluate, as we just said, how the applicant describes himself or herself along multiple dimensions. I looked at 2 assessment strategies, and I like this one because it's talking about immediate memory, delayed memory. It's looking at visual and spatial language. It's looking at attention. I like those because I think they are closest to what you're looking to determine, if it matches where you want to bring them into the employ. Again, I thought this one was good too. It's a short screening battery and is useful for verbal fluency, again, executive planning, inhibitory control, and sensitivity to interference. This is a big one. You need to know, does this person take direction? Are they willing to be part of the team? So this is not a vulnerability pre-eval. This is a strength re-eval. Okay, employment. So, selection of candidates by talent. There are 2 reasons for the structured questionnaire. One of them is so you can see exactly where the person falls on the continuum of the bell-shaped curve, where are their strengths, what are their talents. The other is that going in, you now have in writing a complete understanding of what that person is offering you. And I think that's really critical. It's more important than the standardized test because in a way it's your contract. They are contracting with you to tell you the truth. We already looked at masking and we know getting the truth is not easy. So in effect, you're sometimes functioning blindly. I say right from the beginning, get a full understanding of who the person is. And this would become, in a way, even if there's a follow-up with a formal contract, if that would be the case, you now can say, here's what you told me. Here's what you said you could do. And here's what I'm holding you to if you are working in this employ. Do standardized tests when combined with the structured questionnaire build a profile of a sufficiently high level of commitment to outcomes and motivation to succeed? That's what I'm looking for. Does the business have a serious intent? Does your business have a serious intent to follow through and support a possible successful outcome? What types of strategies work? Coaching, supportive strategies, redesigning the workplace to reduce interference, hybrid versus virtual versus back to work, mixed teams of neurodivergent with non-neurodivergent, skill training for deficit area. I am definitely recommending skill training for areas. If the person is talented enough and you want them on your team, I am recommending skill training for deficit areas. And that would be something that would be discussed with the employee prior to taking the job, because now you know a lot about how the brain functions, and you would be wanting to know for sure exactly what that person would be willing to do if they are showing that kind of deficit in the area, mainly of the memory and the processing. And finally, can the workplace overcome bias or fear of failure of a new hire because of their neurodivergency? Create work placement contracts that address special recommendations for training based on the evaluations, the number of sessions the person is in agreement to, choice of team versus individual, who will be conducting the training. Probation of candidates is iffy. If you hire by talent, then it is likely the workplace skills can be developed in the teams and by skill readiness training. A qualitative questionnaire should be provided periodically to determine from the individual how the trainings are being experienced by them, Also, which accommodations the employee would benefit from. A collaborative skills model based on understanding what motivates individuals to succeed, ownership of outcome, input into workflow, division of labor based upon capability, cooperation, etc. Respect for the capability of the other team members. In other words, what I'm suggesting is that the team members would be part of the decision-making, if it's a team, of how and in what manner all this will work. Good skill match between the expectations of the team and those possessed by the individual. Attention of team member to the successes and failures of each other in the sense of one for all and all for one. Accepting that every team member is there because they have earned it in one way or another. Being responsible to the expectations of team members. Let's go back to masking. You're going to have to tell the truth when you go for a position. If your talent is there, that's the fact that you're neurodiverse is not a deal breaker. Not ignoring deviance, but having methodology to discuss it as a team. Building a self-directed team that includes neurodivergent individuals. And every member of the team is accountable. I am definitely going to lean to autonomy and that they perform assigned work independently. Do self-directed teams benefit from inclusion of neurodivergence? They do, because these are people who can work independently. Again, we're going to say that the high level of critical thinking probably follows the bell-shaped curve. Social communication skills, while it's not a strength, can be offered to team members. And often they are people with a high level of commitment to outcome, but again, bell-shaped curve. So, informing your programs, the most important thing you have to evaluate is the spiky profile, the talents, and decrease the struggles. That may mean some physical environment issues, being very clear and precise as to what you are expecting the individual to do, because we know there's resistance. We know that they are not easy to direct because of the spikiness. Understanding neurodiverse challenges can assist employees in helping a colleague to manage his or her challenges if the colleague is viewed as an integral and important part of the success of the project. Define the recruitment process to the extent that the organization is willing to invest in finding the right person regardless of their challenges. I am going to move right along. All participants in the project define the workplace policy and create a means to examine it when the policy is no longer helpful or needs to be amended. I am leaning up to self-directed team development as probably the best model for diversity, equity, and inclusion that involves neurodiverse persons. I found an example of Charles Proteus Steinmetz, who was a German-American mathematician and genius and electrical engineer. And I wonder how many geniuses are not neurodivergent. And they decided that in the lab that he was working in, that he could no longer smoke his beloved cigars. And he said, if the cigar goes, Steinmetz goes. Accommodation was made. And I think if we keep going to the issue of the talent, the strength, and not the vulnerability, appropriate accommodations can be made, but mainly skill training where necessary. Skunk work projects. Probably a great deal of these people who are capable of working so individually and independently and are so brilliant on their own have come up with IBM's first PC was built in less than a year, and when they were off-site. So I would believe that neurodiverse skills can be a tremendous benefit So let's go. Neurodivergents have spiky messages which create lags or lapses in timeliness, and the results are difficulty understanding what to do, how to do it, frustration, shame, and withdrawal. Adaptive skills development should begin as early as possible, even in young babies, where the individual is taught to remessage the information. Recent research shows that even as late as young adulthood, brain stimulation or retraining can provide a path towards long-lasting change that will improve the spikiness and increase social adaptability. This is being done at the University of Rochester. A neuropsychologist can develop programs in the workplace managed by the teams or in privacy for the individual that are a series of activities that shift the way the brain accepts information. Movement therapy is considered an important therapeutic intervention for Parkinson's disease, dance therapy. Movement and sound systems are being explored with stroke victims, and my company, Linden Neuropsychological, has been practicing in this model with young children for decades. Neuroplasticity. We can change the way the brain sends messages further into life development than we ever thought possible. And it is creating a more positive outlook for the neurodivergent challenge with time and duration. Key takeaway points. 1 out of 25 births in the US will be neurodivergent in the next few years. Neurodivergency is a brain system that responds well to early interventions. Numbers suggest that neurodivergency, I didn't say this before, but I think it could be a normal phenomenon of evolution. Neurodivergency is a brain system that in different degrees hampers the ability of an individual to respond in a timely manner. Neurodivergency is a brain system characterized by information lapses. Neurodivergency is a brain system that can be assisted to process more quickly and retain information more accurately. Neurodivergency is a brain system that responds well to training if its focus is on adaptability and self-regulation. We're all in this together. Our programs at Birch Price, this is the first one, and they will be followed up by Tracy Corbett is going to do a program on bias, generations in the workplace, where she's presently doing this at Western Michigan University, and Dr. Jennifer Huffman, who is a PhD pediatric neuropsychologist through her company, the ABLE Center, is going to talk about being neurodivergent in the workplace and perspectives from her neurodivergent mind. I'm going to come back and do creating hiring and training practices to include in the workplace. And we can be reached, all this information will be in the package of handouts, and you can go on to the website, onto the Zoom actually, and you can print them out. Okay, let me get off this. I'm going to answer questions